Thanks for joining, everybody. Just letting you know we'll get started in a few minutes. Let people filter in these first few minutes of the hour. All right. Thanks, everybody, for being here today. We'll go ahead and get started. First, Jordan, if you want to go ahead and start recording. Thank you. First, we'll start with just welcoming you all to our Community Engagement Forum. This is a partnership between Accords and the CCTSI Community Engagement, and we do these quarterly. So thank you for being here for our session today. You saw a bunch of upcoming events on our opening slides if you were here for the last couple of minutes. We've got some exciting things coming up as well. So our next Community Engagement Forum will be January 25th, 2023, so coming into the new year. And then I want to highlight our next seminar for the Health Equity Seminar Series that Accords puts on. Next Monday at noon, we have Monica Perez-Hole talking about co-creation, which overlaps with some of the topics we cover here in the Community Engagement Forum as well. So something I wanted to highlight for all of you. As we get started, I want to recap a little where our Community Engagement Forum has been in the last few sessions. So we have really been highlighting our theme over the last few quarters of understanding and appreciating the capacities of the community. And we have focused on finding a partner, developing your partnership in the community or with an academic partner, shared decision-making, and data ownership. And today we're going to focus on dissemination with community partners. So I'm going to start us off with just a little, very brief introduction to dissemination and some key ideas about that. And then we're going to hand it over to our partners from the Invested in Diabetes Project. And they're going to talk about some dissemination efforts they have been designing for their project. Let me get us started here. Everybody see slides? I see some nods. Excellent. So I'm just going to talk a little bit about dissemination in communities and what does this mean? So Merriam-Webster says that dissemination is the act or process of disseminating or spreading something, and specifically the state of being disseminated, dissemination of ideas. So the idea that we might sow seeds of ideas with other people, spread them to people who don't already know. In a more technical sense, when we're thinking about health services research, we're talking about addressing the research to practice gap. So how do we get the things that we've learned through research into practice in clinical and community settings? How do we get people to do the things we know work? How do we get those things to work well in other places? And so this is a space that is really transdisciplinary, and that means that we work with people who have different areas of expertise, sometimes academic and sometimes in the community. Dissemination is really focused on the real world context. How do we share what we know in the real world? And it really incorporates stakeholder feedback to increase fit and relevance. So that could be stakeholders of all different kinds, patient stakeholders, practice stakeholders, clinicians, really anybody who has an interest in the things that you have to share. So one of the ways we can think about disseminating information is who is going to use that information and what is their sort of approach to new things. So this purple line here, you can see, really describes who is uptaking when. And so you have this group of people who really are interested in new things, and they will take up new ideas pretty readily. And they're usually the first people to do that early in a process. And then as you continue to share these ideas, you have these different groups of people. So the next group of people might be early adopters, and they're starting to see benefit of something new. And then you have this early majority. They're seeing that a new idea, a new product has some real benefits, some gains for them. And then you have the later majority. They're seeing that all these people are getting benefit from an idea or a product, and they're ready to take that up. And then you have this later group, the laggards, who really are not going to take up a new idea or product until they really have to. And we see this process play out with all kinds of ideas, new evidence, products across the lifespan. And eventually you get to a lot of people taking up that new information. When you have that new information, so that could be, again, an idea, a product, evidence in a health services research space, you want to think about who needs to know it. And so we often think about two major audiences, but that it could be a different group depending on what you're working on. But you might think about patients, for example. And if that's your audience, you want to also think about what do they need to know? What is the evidence that you want, or the ideas that you want to convey to them, and what do you want them to do with it? Similarly, you might think about an audience being a practice. So what is it that you want that practice to do? How do you want them to take your information, and what do you want them to do with it? And once you've really started to think about your audience and what you want them to do or know, you want to think about how you message to them. So taking those two examples, patients and practices. In patients, you might think about in-office education materials as one strategy for reaching patients. You might think about ways to use your EHR to message to them, mobile apps, peer educators. So there are all kinds of ways to reach people, but you want to think about what's the best way to reach the audience you are trying to reach with your information. On the other side, you see some examples of things that might work for practices. So what are ways you can get the information you want to the practices in a way that they can use it? So those could be EHR templates, a strategy for sharing information directly in the EHR that could be used in a clinical visit. You might think about a playbook or how-to guides. You might think about provider scripts or MA and nurse guides. So you want to think about what's the way I can reach people with the information I want them to have. I want to tie this back to what we talked about in our last forum. So our last forum really focused on data ownership and data sharing. And when I think about data ownership and dissemination, I think about how that shared ownership of data also means a shared responsibility for disseminating what we find. So what is it that together our academic and community partners can do to share that information with our stakeholders? How are we responsible for stewarding that data into the groups that we want to know what we learned. We can think about sharing data in community. So not just sharing data or findings with particular stakeholders, but feeding back to people who participated in our work or who might just have an interest because they are part of the communities that we're serving. And then thinking about shared decision-making and dissemination. So both academic and community-based dissemination requires our partners to share in deciding what to do with our data, to have discussions about what the right approaches are to disseminating our information. And then coming back to this curve, as I get ready to hand off to our speakers today, I wanted to come back to this dissemination of innovation model. And in talking with our panelists speakers today, I wanted to point out they really saw themselves in this space of early adopters of innovative approaches to disseminating with community partners. So thinking about researchers and partners who have done this work, who have shared with multiple kinds of stakeholders the work that they're doing, and they're now ready to share with you and hopefully have some of the members of our audience take up their approach and do this in other topic areas. So okay, there we go. Let me introduce our partners today. So we have the Invested in Diabetes research team members. First, we have Ramona Corin. She's a patient partner on the team and has been with the project since the very beginning design phases. We have Sharon Trujillo, also a patient partner, and she's been working on the team for about 3.5 years. And Ramona and Sharon are collaborators and partners in crime on this project. They've really been leaders in the patient partner team on the Invested in Diabetes project. We have Robin Werner, a university team member who worked with practice partners to implement the project, more formally a practice facilitator. And then we have Dennis Gerfinkel, a research assistant and project manager who also works here at the university. So I am going to hand it over to you guys. And just a reminder to everybody who's attending, please feel free to put questions, comments in the chat, and we'll have some moderated Q&A after these guys share their project work. Thanks for being here.
Thank you, Sarah, for that intro. Today we're really going to be talking a lot about how we engage our patient partners throughout kind of all aspects of the project, and just kind of the impact and legacy that they've left on the project, which has been significant. Just really quickly, the Invested in Diabetes project is a cluster randomized pragmatic trial. We're funded by the Patient-Centered for Outcomes Research Institute under our multiple PIs, Drs. Bethany Kwan and Jeanette Waxmonsky. And just really briefly, the project itself was, we wanted to test 2 different approaches to doing diabetes shared medical appointments. So what those are is it's a way for patients within practices to get diabetes self-management education and support training from their primary care, and also have a joint visit with a provider with prescribing privileges to help with medication management, things like that. So we didn't have a control group, and what we did was we had 2 arms of 22 practices that implemented diabetes shared medical appointments either in a standardized approach where we basically gave them a set evidence-based curriculum, the targeted training and illness management curriculum, and had them have a health educator such as a diabetes educator or a nurse or an MA deliver the content, and then have that provider visit as well. And then the other arm had, we call it the patient-driven arm. They also had a multidisciplinary care team, which included behavioral health providers, and then also peer mentors that helped to facilitate the classes. And then patients were also able to select topic order and emphasis. So those were some of the elements that our patient partners thought at the onset would help improve outcomes for the study and for patients. So we're not going to really focus on the study today. Instead, what we're going to focus on is really how patient and practice representatives, particularly patient representatives, were engaged in the research from the very beginning, from prioritization, design, through all the way through conduct and especially dissemination. So we have a little graphic of how our different groups kind of worked with one another. But before I hand it off, I just wanted to say that, our patient partners are really involved from everything from the design through helping us select our outcomes of interest and practice materials, things like that. So not just dissemination, but they were involved throughout the whole process. So I wanted to hand it over to Ramona and Sharon to talk a little bit about their experiences.
Hi. One of my most prevalent memories of doing this project was when we first started, as Sarah had mentioned, I was there from the beginning, was the patient representatives on the steering committee. We had a whole list of things that we wanted. And through this whole project, they have stayed true to what we asked for. And they've really figured out ways to get it done. Some of them were like, we did an in run, around, but we got it done. And it was kind of like at times we were making it up as we went along. So it's been wonderful for me. And I'm really proud of the work that we've done. So we've done, so many things. We started with surveys and interviews and helping with the curriculum guide. I don't know if we mentioned, but our study was about 2 different ways to deliver education classes to patients. So we did a work on the curriculum from a model called TTIM. And just on and on. We've been involved so much, and it's really cool that, we're sitting in our little engagement meeting, and next thing you know, the team's doing it. They're, coming back and asking, well, here's, what do you think since we did this? We do a lot of input, and there's a lot of respect and give and take. And it's just been great. And Sharon, you're up.
Yeah, I think Ramona's right. This has been a very exciting project to work on. Research for me was some faraway land that had nothing to do with me when I first started this project. And I didn't see the connection. And I've come to, of course, realize that it has everything to do with me and my community and our communities, and that it's really important for patients to be around the table. And this Invested in Diabetes project really made an effort to have patients around the table. And I feel like our input was really valued, and I think it added so much to the project.
And yeah, so as we kind of mentioned, we've had a lot of different areas where we took the input of Ramona and Sharon and the rest of our patient partners. We have 3 others that are currently sitting on the project. And here are just some examples of current dissemination that we've done to date. And we're really going to be focusing on the first and the last one. So the first one is a manuscript that Sharon and Ramona were co-authors on, which began with developing methods for recruitment messages for practices who are having issues with recruitment. And then the last one is this patient engagement guide, which we're really excited. It's something that was started by the patients themselves. And yeah, we're really excited to share it with all of you. So if Sharon and Ramona, if you guys want to start talking about, what the process was to create the patient recruitment messages, what those were, and how that came about.
Well, in our meetings, it had come up, the researchers had mentioned more than once that they were having trouble getting recruitment. The practices were concerned because they didn't know how to get patients to come to the classes. So we talked about that, and we had a meeting, and the whole team threw out different ideas of what we should do, and just thoughts. And Bethany asked Sharon and I if we would give a try at writing messages specifically aimed for the patients that might relate to them. So after several meetings at a coffee shop, we came up with some stuff. So Sharon, you want to tell about how the messages and how we came about doing that?
Yeah, I think with the brainstorming sessions that Ramona and I had, we came to the realization, we just figured out that diabetes is not a one size fits all, disease. And it made sense for us to, create messages that spoke to all sort of different stages of the disease. And we also felt that it was important to create messages to the people who support patients, diabetic patients, whether that be family, partners, whatever. That was a really important piece in our messages. So I think that was sort of, that those brainstorming sessions really helped us figure out what the messages could be and were. And I think we came up with a really good product for that. So I don't know, Dennis, are we going to show that slide? Yeah. So here's what we came up with. I'm really proud of this. I think I think these messages can go out. A clinic can use them. Any clinic can use them to help get messages out to diabetics and help support them on their journey.
I'm gonna talk a little bit about what this is like to work with the research team and patient partners and the healthcare team, and specifically about these messages. So as been said, recruitment is challenging for these classes, these shared medical appointment opportunities. And we were just trying to provide all sorts of strategies for practices to employ or deploy throughout the project, because they had plenty of time to try different things, to PDSA different things that were going to potentially work for them. And it was a lot of phone calls, a lot of trying to track down patients and using the same messaging, like, we think this would be really good for you. We think you would really like this. But that wasn't always landing with all patients. And so as Ramona and Sharon heard this, and the other patient partners heard this, they thought, I could drill into this. I could talk about what it's like to be newly diagnosed and what was important to me at that time. I can talk about when I've had struggles during times that were more stressful for me, and managing my diabetes became more difficult during that time. And we could really refine these messages for these patients. And hence, that's what we're looking at. And I had the wonderful opportunity of taking these messages to the practices and saying, would this help? Will these messages help you reach more patients, to try to have them accept your invitation to come to shared medical appointments? And they were thrilled. They were thrilled with the refined messages. They were thrilled that they were able to try to target their messaging to the specific patients. So for instance, everybody always wants to reach that A1C over 9 part of your patient panel. And this was really good because it gave them those targeted messages to do so. So anyway, very popular, very much appreciated. It became a strategy that we didn't expect that we would have at the very beginning of this project, but because the patient partners were part of our research team and listening to what the practice partners' struggles were, they were able to come up with this, and we were able to take it back to the patient or practice partners as a strategy. And if you want to go to the next slide, Dennis, I will say that they were so popular and so well received that on your right, you're looking at the implementation guide that we created for dissemination of this project. And these messages were absolutely included in that because in the guide, because they were so helpful and such a great, unique product of what the patient partners brought to the project and what they brought to the patient partners and hence the patients as well.
It was really cool to kind of see these messages kind of go through, the academic channels. We had a manuscript that was published with the messages, but then also go directly to the communities that needed them, the practices themselves. So that's kind of one example. The other example that we wanted to talk a little bit about is this guide to engage patient partners in health research. So I just wanted to start us off on this discussion. This is something that was completely envisioned and brought up by our patient partners. This was not something that was in the grant by any means, but this is something that, was identified as a need. And then we were able to help, support the patient partners, but they took it and ran with it. They developed this and took it, and it's almost completed. So I'm gonna hand it back over to Ramona and Sharon and talk about this guy.
Hi. First of all, I saw in the chat, someone had asked if we could talk more about working on a manuscript. Basically what they did with us was they wrote it, they would email it to us. We got to give input, kind of look at what was going on. And, we got to see the finish. So it was a give and take. That's kind of how we did the paper. So I just wanted to address that. As far as the guide, we sent around, Dennis and I sent around a survey to the team members, research and patients about, basically the roles involved and what they thought about working together, and just these cool things. Well, the main result that came from that survey was that there was confusion about who was supposed to do what and how you did it, communication and things like that. So we decided to write this guide, and it's practical. We hope that it's practical and it'd be helpful. It's aimed at helping researchers incorporate patient partners in their projects. So we've got, communication, meeting, identifying clear expectations, helping the researchers kind of know how to target the patients with specifically what the ask is. And so there's just all of this stuff. So we think it's going to be great. We like it, and we hope you like it too. And it's been really fun and very appreciative to the team that they were willing to let us do this, that they saw that this was important to us and recognized how helpful it could be. And so they said, well, you think you want to do it? It needs to be done, do it. So we did. Sharon?
Yeah, it's, I'm very proud of this as well. I think it really shows the whole team effort on the part of the researchers, because we couldn't have done it without the researchers either. And so I think this Invested in Diabetes project was such a shared project with all of us. We all learned, everyone around the table learned something, I feel, through through our input. And I'm just hoping that this guide is just a basis for whatever project you're working on and can help everyone see the importance and the need for having patient partners at the table. The people that you're researching, the community, they need to be part of the research because that's what you're doing the research for. So I really feel that we've come up with a product that's going to help you do that.
And yeah, so the guide really kind of emphasizes just the importance of communication and things like that, and hopefully in a way that will help researchers kind of bring on patient partners, kind of those who might not be as familiar as working with patient partners, kind of getting back to that diffusion of innovations idea, maybe those who haven't adopted having patient voices in their research yet. Hopefully this is a kind of something that they could use to help onboard patients and get that important voice in their research. And anything else that you two wanted, or any of us wanted to share about this guide?
Well, I think that it was kind of an outgrowth from everything that we've done. It's kind of a running theme of bringing new people on. In a lot of ways, we were making it up as we went along with this project because some of the stuff was so new, and the researchers were so supportive of us and our ideals and what we looked at, and they listened. We listened to them, but they listened to us, and it was truly a team. We were a team. It wasn't just researchers and just patient partners. We were a team. It wasn't if and or, it was we. So I just wanted to add that. And I think that's important for anybody that might be working with patient partners to understand that if you really want to have the best results, you want to include the conversation, all of the voices. And also it's important for the patients to hear what the researchers are saying and how that works together. So to go back to this slide, communication, always, and there's so many ways to do that. So we explore some of that in the guide. So we hope when it's finished, you can look at it and get some help.
And on that note, so we are kind of finishing up the guide, but we would love, help if anyone on the call is working with patient partners or thinking about working with patient partners and want to help us pilot some of this. We'd be please reach out to us, and we would love some of your insights. And we wanted to open up also any thoughts from you all about how else we can share our findings through specifically non-academic channels, ways that maybe we can explore, ideas that would go to communities and not just, to the universities.
All right. Well, I think we're at the point where we'd love to hear questions, comments from folks in the audience for members of our panel. Looks like Danielle's giving some feedback.
Danielle.
Thanks, Danielle.
Which guide is fantastic? Just curious.
I can just unmute. I will be working with some patient stakeholders for a grant that I just got funded to develop a physical activity program. And so the guide on expectations for communication is really helpful, and I would love to help you pilot test it. So I'll be in touch.
Yes, please shoot me an email, or any of us.
Yes, thank you. It would be very much appreciated.
Yes, Stan has a question here or comment here in the chat about the best ways to kind of get this to those who need it. He's got a little concern with information overload, that it might get lost. And I wonder if you folks have brainstormed any ideas about particularly how to get this in the hands of folks.
Well, we're working on that. We've looked at a few things, but it's still kind of open-ended. There's possibilities. It will be presented at a conference this weekend, the guide, and both of them, I think. But you know, we've had some ideas. We kind of like to maybe go to some of the clinics or somewhere around the state, and you know, talk about it, and not just about the guide, but the engagement that we had, how the team worked together, to encourage more patients to become involved and work with researchers, and vice versa. So those are just some things we're kicking around. So any ideas you guys have, that's very much appreciated. Thank you.
Kaylee put in a question specifically for Sharon about research feeling so far away from you before this project, and wondering if you could say a little bit more about what got you interested, what brought you to join the team and have your voice included, and then how you see that, how you see your involvement going forward.
Thanks for the question, Kaylee. Yeah, what I got bought into the project because I had went to a diabetes education class, you know, a couple years before I even got bought into the project. And the person who was teaching the class reached out to me about a year later and said, hey, they're looking for someone to come and talk to them about your diabetes experience, and I think you'd be great at this, and could you talk to this group? And I'm like, yeah, sure, this is interesting. And somebody wants to hear about diabetes, sure. So I thankfully a person saw my potential, and I got bought into the group. And otherwise, I don't think I would have ever heard about being a patient partner or a patient stakeholder. Like I said, the research world was, you know, another planet for me, didn't even see the connection. And moving forward, I mean, I would love to see more of me's in this brought to the table. I know that I've asked that question as well. How do we bring more patient partners to the table? And maybe that's another research project or a research paper, manuscript, but the question has been asked, and I would love to be part of research in some way, however I can help, but I don't know exactly how to make that happen moving forward.
Great, thanks for that, Sharon. Let's see here. Some of these questions are getting answered in the chat, but it might be good to hear a little bit more. Jonathan had this question about how the patient partners were funded, and I know that they were written into the PCORI project, but even prior to that, when the stuff was being developed, I wonder if y'all could speak to that a little bit.
So this is a little bit before my time on the project, but I know Ramona was pretty integral to the creation of the grant itself. I don't know if you wanted to say a couple of words about your involvement with the boot camp translation project beforehand, or anything about how Invested came about.
Sure. As Dennis mentioned, there was a boot camp translation. So I got invited through my clinic, and I went there, and there's like this room, and there's 12 patients, and this huge room full of all these different experts, and they're looking at us going, well, what do you think you need? So I'm not shy, so I immediately jumped in, and others came in, and there was 3 of us who stayed for the steering committee, and we worked really hard with the guys, you know, the researchers and us. And it started out from the very beginning. We were all a team. We told them what we thought we needed, and they asked us, you know, how should we do that? And it was vice versa. We're telling them, well, we don't know, you show us, you know, and it was like that. And the first time we had to rewrite it. So it took 4 years altogether to get funded. I was telling Dennis earlier today, when I found out that we had been funded, I was crossing the street on the way to my bank. I'm in the middle of the street, jumping up and down, going, woo! I'm sure everybody thought, but it was so cool because we'd waited so long and we got funded. So we just went through that process of steering committee and who wanted to be involved and just how to do it, you know, and it took a while. It was kind of a really good process. And so for us, the patients, it was just, we wanted everybody to get education. So the guys figured out how we could get a grant out of that by doing this comparative study, which was very relevant. And in the end, we've come up with some very good data that supports that the classes do help. So that was our main goal. So that was the kickoff.
Thanks, Ramona. Rachel's got a really interesting question here about, you know, this transition from, you know, feeling like your patients to really being part of the research team. And if you guys have thoughts about what that transition was like, how you sort of started to think of yourselves as fellow researchers, if you do, and rather than just you know, participants in a project.
Sharon, I'll leave that one to you. You came in the middle. It was like, you know.
Yeah, it was a huge learning curve. And for me, the learning curve was the research lingo. You know, what are all these new words and how do we use them in the research world? And still to this day, that is my learning curve. But it's worth it to me to be around the table if it's going to help with the research. Of course, I come from a family who most of them are diabetics, and you know, the world, it's a disease that is continuing to grow. So the work that we do is really important. And yeah, it was a huge learning curve. But to the researchers around the table with us, everybody was willing to help. If they had to explain it 3 times, they did. They were really patient and made it a safe environment, a safe space to be able to share my opinion and to be able to speak. I am a person who is usually behind the scenes, and that's my comfort zone. So doing this today was really hard, but it's if it's going to help my community, then that's what I'm here to do.
Great. Thanks, Sharon.
Can I just also comment? So and this is part of the reason why this guide is so great. You know, it's also up on to the researchers to make sure that the patient stakeholders are heard and kind of respected. You know, especially during like the middle of implementation, it can get pretty hard when we are kind of, you know, in our zones and doing, you know, just implementing the project and kind of, you know, in go mode. And it was great to be able to kind of slow down. And Ramona and Sharon definitely pinged us at times and said, hey, can you please explain this? Why is this important? And it really kind of brought certain aspects back to, you know, why we were doing the research. How is this going to help patients in the long run? So
Thanks, Dennis. Sarah posted a question. I'm curious what other topics you included in the patient engagement guide beyond just communication. And looks like Dennis is primed here with the table of contents.
give a sneak peek.
I promise that wasn't a planted question.
Yeah, I mean, it really, it's about kind of the onboarding process and how to keep patients engaged, especially like I said, in some of the times when there's natural lulls in the research time, and how to keep patients engaged during those times, and how to make them feel, you know, as part of the team.
Yeah, cool. I've got a question for Robin. So Robin, I know you've been involved in a lot of implementation projects, working with practice facilitation. I'm curious if you saw any differences with Invested because of the deep involvement of folks like Ramona and Sharon.
Yes, thank you for the question, Dawn. For me, I work with practice teams that are working with their patients all day, every day, and I want to focus on that. That's what's most important to my practice team. So the fact that I was able to say, as their practice facilitator, patients have said this, patients have developed this. This is a lived experience. This is really powerful. This is not something I can bring. This is something, a patient perspective that was a wonderful opportunity to provide for them. And they were so receptive, so appreciative. And again, that's why it's absolutely part of our implementation guide, because that's a message we really want other practices that are going to use the guide to understand as well, that this is a patient perspective.
Awesome. Thanks, Robin.
Thank you.
Well, other questions? We've got about 5 more minutes.
I think Dennis shared the table of contents, but I would say also that we were purposeful in the design of both guides to make sure that there were these worksheets that you could use if they're helpful for you. I think it's always good to have something to jump off of. And that's why there are worksheets incorporated in both of the guides, just to give a starting point. And it might not be, you know, completely inclusive of everything and transferable to every project, but there is a hope that they are general and broad enough so that they help you get started.
Awesome. Okay, Dennis shared his email for updates when the guide gets released.
I believe the implementation guide's already printed, right? So that's getting out.
Yeah.
And we're real close to getting our patient guide. And I did want to mention that PCORI is going to grab this up. They already asked for the guide, patient guide, as soon as it's finished. So you might be able to find it there later.
Yes,
Mm.
I'm gonna post the link to the implementation guide if you are curious about that. So this is about disseminate or starting shared medical appointments in primary care.
Great. Thanks, Dennis. Looks like Sarah's got a question about what do you hope the patient engagement guide will do to change things in the next 3 to 5 years? What are your dreams for it?
Well, we would like to see it make a big difference and ease things in. Partly too, for me personally, I hope that there's an opportunity for researchers to figure out how to reach out to the community. There's a part in there about, figuring out the role and making sure you're getting the right people for what the study. So hopefully this will help refine that process. So we get more patients involved. The more voices we have, the better the research. And everybody's story is so different, and to bring them all together is how we get this done to the best results. So, Sharon, what's your hope?
I always have big dreams. My hope is that patient partners become some sort of group or organization or something within the universities. There should be, my hope is there's an office that reaches out to patient partners to bring them into all the research that's happening in the universities.
That's a beautiful idea, Sharon. I love it.
Yeah.
Well, that's something for us to work on.
Pipe dreams.
Yeah.
Yeah.
We've talked about it often.
We have.
Well, if there are no other questions, Sarah, you want to close us out?
Thank you for a wonderful discussion of your project and a lot of great advice for people here today. Just a reminder to please complete our evaluation, tell us what we're doing well, tell us what we can do better so we can keep putting together awesome forums that are beneficial to all of you. And Jordan's put that in the chat. I think probably drop it in again before you guys all log off. We've recorded today. We always record our forums, and they'll be released and available on the Accords Education website. So you can share those with your colleagues or see some of our prior forums as well. And then I just wanted to remind everyone, we have a couple additional upcoming events. So our next community engagement forum will be January 25th, 2023. And then I again wanted to highlight that upcoming seminar in our health equity seminar series. So next Monday at noon, we'll have Monica Perez-Jole talking about co-creation in health equity research. So we're excited for that one. Well, thank you all. Again, that evaluation link's in the chat, and I hope you all have a wonderful afternoon.
Thank you.
Thank
Bye.
you.